Good morning. If I have other panelists, please, you can come up and take your seat at.
We're having the community health worker panel on their own.
Oh, okay, and then bring up. Oh, okay, thank you. So I'm delighted to be here. My name is Karen Murphy. I happen to be one of those that Brian described as being dropped in to the position of Secretary of Health. So I don't see Brian here, so I'll tell him that thank you for that. Sure. So we have a very interesting panel. I think it's always great to listen to those that are on the ground and really touching the lives in terms of public health. And today we have an expanded panel. I'm delighted to welcome our community health workers. We have Shanteny Jackson, who is a community health worker with Richmond City Health District and the VA Community Health Worker Association. Orson Brown is a community health worker with the University of Pennsylvania Center for Community Health Workers. Kevin Jordan is a community health worker with Damien Ministries and a member of the Maryland Community Health Worker Committee. And Adriana Palacios is a community health worker with the Oregon Community Health Worker Association. So we're going to begin with our panelists. And the first question that I really want to ask is, broadly speaking, maybe everyone could, and we'll start with you, Shanteny. Maybe we could begin with, how do you see the role of a community health worker, and how does it intersect with the healthcare delivery system?
Well, thank you very much for inviting us here. The roles of community health workers vary depending on the community, but they are standard. So the areas that I've experienced are navigation, advocacy, education, and outreach. All of those buckets, if you will, are important because our clients need help with navigation, navigating the health system. They need help with outreach. And so how do you know what's available in your community if there isn't someone who could speak about that? And the other part that is critical is the advocacy, knowing and empowering our clients to be able to be self-sufficient or move around the barriers that they may experience. So that piece is critical. And lastly, the education. How can we transform the barriers into advantageous areas where they can move towards thriving communities, thriving individuals? So I see that there is an intimate connections between, or correlation between, the roles of the community health workers and the health itself. And so the same buckets that I spoke about earlier are very impacting in what it is, the health care, or how do we transition our clients into that respect. Navigation, education, outreach, and advocacy. All of those aspects are embedded in our health system. So I'll pass.
Thank you. Kevin, would you like to take that?
Good morning, everyone. My name is Kevin, community health worker. And for the first question, I see community health workers as the liaison between the community and the healthcare or the clinical setting. Because what we're trying to do as members of the communities, we're trying to engage our own members from the community into the healthcare system and trying to bring them into a clinical setting and linking them to health services. And pretty much what Shanteny Jackson said, it's like a circle of things that community health workers do. And when it comes to the from my experience working in the HIV field, what we call the continuum of care, as community health workers, especially working in the HIV field, I myself start with outreach, telling people about infectious diseases such as HIV and STIs, or sexually transmitted infections, and a lot of education and bringing people to do what we call walk-ins for rapid HIV testing. So it's used as a screening method, and then depending on the results, we try to link them to a clinical setting where they can get tested for what DC has called the gold standard for fourth generation HIV test. And again, depending on those results, if they come back as positive, they could come back to us. But we're always sort of like walking alongside with the clients, with the individuals, making sure that they go to their appointments, making sure that they are talking to their case managers. And there's different levels of case management. There's non-medical and medical case management. And so for my particular agency where I work in Damien Ministries, we offer both. And we work closely with our non-medical and medical case managers because something that we've seen is that when we integrate community health workers into the work that we're doing, especially in the HIV field, we're able to sustain our clients. Client retention increases. And so that's better overall for clients as well as for them to be on their medication. We're talking about treatment adherence. And it's just a circle or a team effort, and pretty much done.
Thank you.
Thank you for having me this morning. The question at hand is, what do I see as the roles of community health worker and how they fit into the health sector? I personally feel that the community health worker is an intricate part of the health sector. It's a role of bridging gaps. So many oftentimes our patients that we deal with in our communities have a disconnect from their doctor's offices. Despite the fact how many they have a relationship, they've been going to the doctor for many years, but there's a mistrust, there's a misunderstanding of them being heard and them being understood. The role of the community health worker is to partner with that particular patient, to get to know them personally, to find out what's their strengths, what's their fears, and to find out a plan that they're comfortable with actually achieving health goals that can be attained. I think that's an integral part that is very important. At Penn Center of Community Health Workers, we have seen personally the positive effects when a community health worker can come into, someone's house, find out what that barrier is that is preventing them from making it to their doctor's appointments, and helping them come up with an action plan to actually get something done. So I think it's an intricate part of the health system.
Adriana, I'd like you to talk about what do you think are the key ingredients to a successful community health worker?
Having a community, being part of the community, because as community health workers, we are generally trusted members of that community. And usually we are able to make that connection in order to identify the real needs of the community versus what's being perceived as the needs of the community. So being part of that community is definitely key in having that trust from that community.
Orson, do you have anything to add to that?
I would definitely add to that. I think you definitely have to be from the community to be an effective community health worker. I also think early this morning we talked about, training. We heard a lot about training. And I think that's also a part of it, but the structure of that training, the supervision, the right people to be over the work is an integral part of the success of a community health worker. So oftentimes community health worker can get burnt out or literally be spinning their wheels without the right structure, case loads around them. At the Penn Center for Community Health Workers, we've done a very good job of making sure that you don't get burnt out, you have support, and that you know exactly what you need to be focusing on. You can get dragged down so many different holes trying to support people, but when you have the right structure around you, you can be effective in your work.
And And to add to that, also, it's a team basis. So you work with clinical staff in order to support the work that you are doing as a community health worker. So it's a multidisciplinary team that is target to find the solutions, if you will, or find resources for that individual who's coming to the clinic for a specific reason. So at Richmond City Health District, we have a team of, at our resource center, we have a team of 4, the nurse practitioner, we have the public health nurse, we have the community health worker, and we also have the resource center specialist. So the resource center specialist would register and welcome the client. Then if there are certain issues that are not addressed by the staff or the administrative staff, then it comes to the community health worker. So there is some level of engagement and connection initially with the client before they go see the actual clinician or provider. And so when that is addressed, it reduces the time in which the clinician will have to spend in asking these just generic questions, and instead they can focus on the medical needs. And so it's important to highlight that because we work as a team. Just like in the community, everybody has a role to perform, then it's the same case or the same thing in the clinical setting. And after the CHW has done her investigative initial work or assessment or investigation, then they move to the clinician to determine and focus on that medical need, and then they may return to the community health worker to find that service of navigation or that service of social determinants of health that will help them move from wherever they are to wherever they would like or need to be.
So with our remaining moments, and we'll start with Kevin. Kevin, how do you see this profession growing to be a community health worker? And are you seeing any new trends, or is the role of the community health worker changing as it grows in time?
I think that now that I've been involved for the past 5 years, I see that it's something that's starting to take off, and people and researchers and public health officials are putting more attention to community health workers and what we do. I think specifically about what's happening in my state of Maryland, as I live in Maryland, Prince George's County, how in 2014 a work group was put together to advise on the types of training and workforce development that community health workers would need. And then recently, House a bill, SB 163, was passed last year, 2018, to create an advisory committee for community health workers in the state of Maryland so that we could advise the state on the trainings and certification, how that would look like for the state of Maryland. And so I'm delighted to see that Maryland's taking a big initiative when it comes to community health workers. DC is doing something similar. We've always had the Institute of Public Health Innovation do amazing work with community health workers and a lot of advocacy when it comes to that. And now, just recently, DC Department of Health started having internal committees for talking about or discussing about community health workers in Washington, D.C., and how that would look like, and inviting community members and community stakeholders so that they could participate and sort of advise D.C. Department of Health. And so I think it's evolving in a sense that there's a big push, a trend to obtain certification for community health workers because so many other professions such as nurses, social workers, they all have their certifications, their trainings, their licenses that they have that make it more, I want to say more certified and much more recognized, and have benefits that unfortunately as community health workers we do not have, but we're working towards. Of course, there are some instances in some states where there is certification, and there's a big push and a lot of progress that's been made, like specifically in the state of Virginia, but Maryland, we're getting there as well, and then DC, we're trying to do that push as well.
Thank you. Well, we're up to our time now with this panel, but I'd ask you to stay so that we could continue this discussion in the question and answer period. And while we're asking the other panelists to come up, I'd like to introduce them. We are going to have Cherie Conjovi, who is the founding executive director of the Penn Center for Community Health Workers. Noelle Wiggins is a senior research and evaluation consultant with the Oregon Community Health Workers Association. Michael Ryan is president and CEO, and Juan Monroe, program coordinator of the Community Health Worker Initiative Institute for Public Health Innovation. And finally, Katie Wunderlich, who is the executive director of Maryland Health Services Cost Review Commission.